Hi friends, good evening and welcome to my channel Mookambika Nursing. Friends, today in this video we can see important and previous year questions for ESIC exam preparation. Also these questions will helpful for your upcoming RRB exam, DSSSB exam, Insurance Medical Service Kerala PSC exam, DME exam and JPHN exam. We can see the questions. First question. Which of the following condition is associated with increased intraocular pressure? And our options, option A, cataract, option B, conjunctivitis, option C, keratitis, option D, glaucoma. Here the question is, which disease condition is associated with increased intraocular pressure? The intraocular pressure is associated with eye. So the normal IOP, intraocular pressure is 12 to 22 mm of Hg. So if it is increased means it is mainly associated with glaucoma. Option D will come correct answer. Glaucoma is a group of ocular disorder. Ocular disorder means it's an eye related disorder which is characterized by increased intraocular pressure and optic nerve atrophy. Atrophy means progressive destruction of the particular part. Here optic nerve atrophy. Optic nerve atrophy means it is the destruction of optic nerve and visual field loss. Okay, so here in our question, increased intraocular pressure is there. So increased intraocular pressure is associated with glaucoma. Among this option, glaucoma will come correct answer. And first option, cataract. Cataract means it is the opacity of the lungs. Conjunctivitis means inflammation of the conjunctiva. Keratitis means inflammation of the cornea. Move on to the next question. Following cataract surgery, how long sunglasses need to be used? Options, option A 4 weeks after operation, option B 6 weeks after operation, option C 8 weeks after operation and option D 10 weeks after operation. Cataract means is the opacity of the lungs. Here after cataract surgery we have to give some self-care advice to the patient. That include first one, the eye patches will be there in patient eye. So that should be keep in place for 24 hours. That we have to explain to the patient. And second one, do not rub the eyes. Okay, vigorously do not rub the eyes. That we have to explain. And third one, wear the sunglasses after the surgery at least for 6 weeks. Okay, here that is the question. So option B will come correct. 6 weeks after the surgery. And also we should tell them limit the activities and also do not lie on the operated side. Okay. Then after surgery we should tell them do not lift the weight. It will become strain to the eyes. So avoid lifting the weights. Take the medication based on the doctor's prescription and do not take aspirin containing medication. That also we have to explain. And also if there is any pain which is not relieved or redness around the eyes or nausea, vomiting, then we have to explain them to report immediately to the doctors. These are all the home care advice after cataract removal. Move on to the next question. An aged client with diabetes mellitus is complaining of a painless peripheral loss of vision is at risk of. Options, option A open angle glaucoma, option B cataract, option C angle closure glaucoma, option D uveitis. And the correct answer is it is open angle glaucoma. Here the manifestation or the complaint is painless peripheral vision. Painless peripheral vision or loss of sideline vision is the first line manifestation of open angle glaucoma. And option C angle closure glaucoma. This is also type of glaucoma. Here eye pain with nausea and sudden visual disturbance will be there in case of angle closure glaucoma. But in open angle glaucoma there will be loss of peripheral or sideline vision. Move on to the next question. Normal range of IOP is. Options: option A 8 to 12 mmHg, option B 10 to 12 mmHg, option C 12 to 15 mmHg, and option D 12 to 22 mmHg. Correct answer is option D 12 to 22 mmHg, normal intraocular pressure. And move on to the next question. The first line treatment of open angle glaucoma is options: option A pilocarpine, option B epinephrine, option C timolol, option D all of this. Here the question is, which is the first line or primary medication for open angle glaucoma? It is timolol. Option C is the correct answer. Timolol. Timolol is a beta blockers. It helps to decrease the production of aqueous humor. This medication is contraindicated or not giving in case of asthma and chronic obstructive pulmonary disease, that is COPD. So in case of COPD and asthma, we are not administering timolol. On to the next question. A nurse is teaching a client how to use the call bell system. Which level of Maslow's hierarchy of needs does this nursing action address? Options: option A safety, option B self-esteem, option C physiological need, option D interpersonal need. Here the question is, a nurse is teaching the client how to use the call bell system in the patient room. The call bell system is one of the communication process between the patient and the nursing staff or patient and the other staff. This is for the safety and security for the patient. So here safety and security will come correct answer. Here safety is there, so that is the correct answer, option A. According to Maslow's hierarchy of needs theory, the physiological needs is the basic need or first priority. Okay, and the second is safety and security. The next is love and belonging. The next one self-esteem and self-actualization. Move on to the next question. A nurse is caring for a client who has paraplegia as a result of spinal cord injury. Which rehabilitation plan will be most effective for this client? Options: option A, an arrangement will be made by the client and client family. Option B, the plan is formulated and implemented early in the care. Option C, arrangement will be made for long-term care. Option D, none of this. Here the question is, a nurse is caring for a client who has paraplegia. Paraplegia means paralysis of both lower limb. And which rehabilitation plan will be most effective? Among this option, which is the most effective plan for the patient? So rehabilitation will start from the admission time itself. That is the most effective plan. Rehabilitation plan means for the recovering of the particular problem. Here the patient is having spinal cord injury and paraplegia. So rehabilitation or recovering from the particular problem, we have to plan the care during the time of admission itself. So the answer will come, the plan is formulated and implemented early in the care. Move on to the next question. A client with upper gastrointestinal bleeding develops mild anemia. What should the nurse expected to be prescribed for this client? Options: option A epogen, option B dextran, option C iron salt, option D vitamin B12. So here the question is, a patient or client with upper GI bleeding and mild anemia. In this case, the nurse thinks that which medication will prescribe by the doctor for this patient. Here the correct answer is option A epogen. Epogen injection is mainly given to treat anemia. And the second option dextran, it is a plasma oleum expander. And option D vitamin B12. Vitamin B12 is mainly given in case of pernicious anemia. It is a vitamin supplement. Here the doctor will give epogen for the patient. It is mainly help to treat the anemia. Option A is the correct answer. Move on to the next question. Hemorrhage in a newborn is caused by the deficiency of options. Option A vitamin A, option B vitamin D, option C vitamin C, option D vitamin K. And the correct answer is, it is vitamin K. Hemorrhage in a newborn is caused by the deficiency of vitamin K. So vitamin K injection is given at birth. Okay. Here correct answer is option D. Move on to the next question. Elevated mood with increased psychomotor activity is the characteristics features of options. Option A mania, option B psychosis, option C depression, option D all of this. Question: elevated or increased mood with increased psychomotor activity is one of the features of mania. Option A is the correct answer. Again today in this video we discuss most of the questions are from previous year question papers. Surely you will get an idea for from where the questions already came. So study according to that, cover all the subject. Do revise with your previous year question papers.